Hello everyone, welcome to my channel. Today I have started with another new topic of the pharmacology, that is antiplatelet drug. It is one of the very important topic. Antiplatelet drug as such can be asked describe antiplatelet drug plus various individual drug antiplatelet drug can be asked as a short note. Then reasoning question, why low dose aspirin exerts a antiplatelet action. So there are and plus many MCQs can be asked from this topic. So let's get started with the antiplatelet drugs. So what are these drugs? These are the drug which is going to inhibit the aggregation of the platelet. So they are going to act by inhibiting the primary platelet plug formation. So to make you understand how this antiplatelet drug they are going to act, let's first understand normal pathophysiology of the primary platelet plug formation. So this is a normal blood vessel. You can see here, and this the blood vessel, this is lined by the endothelial cell, and platelet cells, they are also moving, so they are not adhesive to one another, they are moving freely within the blood vessels. So everything is there within the platelet so that they can become sticky to one another, but they do not stick to one another. The reason behind that, so number one is prostacyclin and NO. These are the two things which are released by the endothelial cell. Now, if the prostacyclin, if it comes in the circulation, what it does, this is a bigger picture. This illustration I have taken from the Principle of Pharmacology by H.L. Sharma and Dr. K.K. Sharma. So here the bigger view of this is a one platelet. Here I have shown a bigger picture of this figure shows a platelet cell. So you can see on the surface of the platelet cell there is a this prostacyclin which is coming from the endothelial cell, intact in the endothelial cell. So from this the prostacyclin, it is coming and it is going to act on the surface of the platelet. Prostacyclin receptor, they are there, so this is going to bind here, which is going to convert ATP into cyclic AMP. Now this cyclic AMP, it is going to inhibit the secretion of this 5-HT, ADP, calcium plus thrombin, all that which is released from the granules of the platelet. So once, if because of that the platelet, they do not stick to one another, this is a one reason. And no, it act as a vasodilator. Now when do they stick to one another? Whenever there is any injury, whenever there is any injury to the endothelium, यहाँ पे अगर कोई injury होती है, then only they are going to stick to one another. Now what happens once the injury happens to the endothelium? This side it was a intact, यहाँ पे ये intact endothelium था, and here it is damaged or injury happens to the endothelium. Once it is injured, then what will happen? Now this injured endothelium, it is not able to maintain, number one is this, it won't be able to maintain this prostacyclin level. Now prostacyclin level, once it falls, then what will happen? Cyclic AMP level will also fall. Once this is going to fall, then what will happen? There will be release of the 5-HT, ADP, thrombin from the granules of the platelet. This is number one. Number two is, now with the injury what happens? It is going to activate this platelet में यहाँ पे आपके membrane phospholipid. So it is going to activate this membrane phospholipid with the help of enzyme phospholipase A2. And now what will happen? From this arachidonic acid that is formed. Now arachidonic acid, it is going to follow two pathway. One is a COX pathway. You can see here in a picture COX pathway. With the COX pathway, there is a prostaglandin that is synthesized, and another one is, this is a COX pathway, and another one is a LOX pathway, lipoxygenase pathway. From this leukotrienes that comes. So very important inflammation pathway. So you read in pathology also. With the COX pathway, the first there is a formation of PGG2. Prostaglandin, they are synthesized. First PGG2, then PGH2, and from that, now what will happen? Depending on the cell, it is going to synthesize, this is a platelet cell, तो यहाँ पे क्या आएगा आपका thromboxane A2 that is synthesized from the platelet cell, because within the platelet it is a thromboxane synthetase, that enzyme is there which is going to cause the synthesis of thromboxane A2 from the prostaglandins H2. Now if we see what happens in the endothelial cell, now in the endothelial cell, suppose if this prostaglandin, if this is formed in the endothelial cell, then what will happen? Endothelial cell यहाँ पे क्या बनेगा? यहाँ पे आपका prostacyclin बनेगा because of the presence of the enzyme prostacyclin synthetase. So दो बनेंगे आपके depending on the site, ये platelet में, ये आपका endothelium में. So these two things they are formed. So always remember A, यहाँ पे A है, A stand for the aggregation. So thromboxane A2 it is going to cause the aggregation of the platelet, whereas I2 prostacyclin, this is not visible. So prostacyclin, this is going to, another one is a prostacyclin. So I stand for, this is going to cause the inhibition of the aggregation. So ultimately this thromboxane A2 which is synthesized within the platelet, it will come into the circulation, and now what it does, it is going to act on the nearby platelet, it is going to cause their activation, and ultimately that leads to aggregation of the platelet. So this was the number one, and once this is damaged endothelium, then this thing happens. This is the number two. Number three is what happens now. You can see here in this figure only, once the endothelium that is damaged, you can see the collagen that is exposed. In the endothelium, one another factor that is also secreted by the endothelium, that is a von Willebrand factor. This is a VWF, von Willebrand factor. Now on the surface of the platelet, there is one type of receptor, that is GP1B receptor. They are there. Now what happens on the GP1B receptor? This collagen along with the von Willebrand factor, they are going to bind here like this. This is a von Willebrand factor, and this is a collagen. So now once this binds, then what will happen? It is again going to cause the activation of the platelet. Once the platelet it gets activated, then what will happen? This receptor GP2B3A GP2B3A receptor, which was inactive as such, this gets activated. Another thing is, now it is going to cause the activation, this collagen and von Willebrand factor binding to the receptor, it is going to cause the activation of the platelet, and here again there is a release of this also, ADP, 5-HT, thrombin and calcium, plus also it causes the, एक तो ये करेगा, दूसरा it is going to cause the bring a conformational change. जैसे ये आपका platelet है, the platelet it gets activated and there will be conformational change in the structure of the platelet, and this receptor which was earlier inactive, ये पहले क्या था, inactive था, now because of this what will happen, this will be converted into active form. Active form is now it is ready to bind, and ये receptor को हम क्या बोलते हैं, these are the fibrinogen binding receptor. Now this is going to cause the activation of this, and it is going to also cause the activation of this. Now so many things they are going to cause the release of ADP, 5-HT and calcium. So what will happen once this ADP that is released? So this ADP, thrombin and ADP, it is going to act on the surface of the platelet itself. ADP receptor they are there. Here you can see the ADP receptor, they are there on the surface of the platelet cell. And what this receptor they are called, it is P2Y12 type of receptor. Now what happens, this ADP it is going to come and bind with this receptor. Once it binds with the receptor, this also causes the conformational change in the structure of the platelet, and what will happen, this receptor GP2B3A which was earlier inactive, this gets activated. So now what will happen, the fibrinogen they will be, you can see here two platelet, one is this and another one is ये वाला है, इसका भी रिसेप्टर एक्सपोज हो गया और इसका भी जो था वो भी अर्लियर इट वाज इनएक्टिव, नाउ व्हाट विल हैपन, सो दिस गेट्स एक्टिवेटेड, ये भी आपका एक्टिव हो गया एंड दिस आल्सो गेट्स एक्टिवेटेड, दोनों के रिसेप्टर एक्टिव हो गए. So what will happen now? They are the fibrinogen binding receptor. Now the fibrinogen, you can see here the molecule of the fibrinogen, how it is making a cross link, this side and this side, both side. It is cross linking the two platelet cell. So this is the final step of the platelet aggregation. With the fibrinogen binding receptor, what will happen? The platelet, they get cross linked to one another and they form a platelet plug. You can see in the next figure, like here, these are the GP 2B3A receptor. You can see in all the cell red color and how it is going to, ये आपका red color का receptor है and this green color जो आपका दिख रहा है green color, that is the fibrinogen, ये fibrinogen है. So how this receptor, they are making a cross link between the platelet cells and ultimately what happens, a platelet plug that is formed or thrombus that is formed at the site of the injury. This is what is the main aim of this platelet. So platelet as such in the circulation, they are freely flowing, उन्होंने इकट्ठे नहीं होना, they are not going to make any plug because they know when to make a plug. When to make a plug? The trigger factor, that is the injury to the endothelial cell. Whenever injury happens, then only they are going to form a plug. So you have seen various sites here, like if the damage happens, then what will happen, there is a decrease in the level of this, then ADP, this is released, then what will happen, thromboxane A2, this is number 2, and this thromboxane, this also act on the platelet. You can see here thromboxane, this act through the TP receptor and ultimately this also cause the activation and aggregation of the receptor. So अब ये इतनी सारी चीजें, जैसे ये decrease this one thromboxane A2, then TP receptor, then activation of this ADP receptor, activation of this receptor, activation of thrombin receptor. Now all these receptors, they are going to cause the aggregation of the platelet. Now if I want to prevent this aggregation, what to do? I will give the drug which is going to prevent all these things. So either a single drug or I will give a combination so that they can act together at multiple steps to exert a antiplatelet action. So what all drug can be there? Number one, the drug, because if there is a decrease in cyclic AMP, then what will happen? There is a release of this. So one mechanism of is this cyclic AMP, which is formed from the ATP, it get degraded into 5-AMP by phosphodiesterase enzyme 3. So if I give a phosphodiesterase inhibitor like dipyridamole or cyclostanazole, then what will happen? They are going to increase, they prevent this जो आपका cyclic AMP है इसकी degradation नहीं होने देगा, ये वाला step, it is going to prevent this. Once it is not degraded, then what will happen to this level which is decreased, it will be increased. अगर इसका level बढ़ता है, then these won't be released, ये release नहीं होंगे, there will be no activation of the platelet, there will be no आगे. So एक ग्रुप तो आपका ये हो गया, दूसरा आपका क्या हो गया, जो इसको करे thromboxane A2 को, ठीक है. Then we have a ADP receptor blocker, ये वाला आपका गया तीसरा. Then we have a GP2B3A receptor, then we have a thrombin receptor and the newer innovative drug that is a TP receptor antagonist. Here only you can see this is a taurutroban. So thromboxane A2, it acts through the TP receptor, it is also going to cause a platelet aggregation. Now taurutroban, this is TP receptor antagonist. Now this is going to inhibit the aggregation. Now this TP receptor, they are present not only the surface of the platelet, they are also present on the vascular endothelial cell and there it is going to cause the vasodilatation if you are going to give taurutrobin. Otherwise it is going to cause the आपके TP receptor as such the agonist, they are going to cause the vasoconstriction. Here taurutrobin, this is a thromboxane or TP receptor, this is TP receptor antagonist. sorry, in the vascular smooth muscle cell, they are going to cause a vasoconstriction, whereas on the endothelial cell they cause the atherosclerosis. So once we are giving the antagonist like terutropin, what it is going to cause, it is going to inhibit the platelet aggregation here platelet वाली साइड में, vascular smooth muscle where it is going to cause a vasoconstriction, where it is going to cause a vasodilatation, जो आपका ये collagen endothelial cell है जहाँ पे ये atherosclerosis, then anti-atherosclerotic effect will be there. So it is totally a new drug, innovative drug, TP receptor antagonist or thromboxane A2 receptor antagonist. Now you can see, depending on that, you can see the classification like phosphodiesterase 3 receptor antagonist like dipyridamole and celestanzol. So mechanism itself it is clear. ये क्या करेंगे, phosphodiesterase को inhibit करेंगे, इसको inhibit करने के बाद ये क्या करेंगे, once it is inhibited then what will happen, there is increase in the level of cyclic AMP. अगर ये बढ़ गया तो ये release नहीं होगा. If this is not released then there will be no activation, no aggregation of the platelet. So अगर आपको physiology पता, that's why I always first hand I teach the physiology. If you know a little bit pathophysiology of the disease, then it is very easy to understand the mechanism of action of the drug. So phosphodiesterase inhibitor, they are going to increase the cyclic AMP. Now you know how it is going to increase the level of cyclic AMP. And then another drug is COX inhibitor. ये आ गया आपका aspirin. ठीक है. So now how aspirin it is going to act? It is a COX inhibitor. ये आपकी number 1 drug होगी. This is a number 2 drug. Now aspirin it is going to inhibit the cyclooxygenase. ठीक है. By inhibiting, and important is aspirin it inhibits this enzyme irreversibly. Now if it is going to inhibit this COX enzyme, then there will be no formation of PGG2, no formation of PGH2, no formation of thromboxane A2, कुछ भी नहीं बनेगा, and it won't be released, and this is not going to act here. There will be no activation, no aggregation of this. Another thing is this cyclooxygenase enzyme, it is not only present here in the platelet, it is also present here in the endothelial cell. So in the endothelium also the same thing is going on. The only difference is within the endothelium, this cyclooxygenase, this is there, this is going to form the prostaglandins G2 and H2, but in the endothelium, as already I have told you, there is a, क्या होता है एंडोथीलियम में आपका प्रोस्टाग्लैंडिन सिंथेटेज ये होता है. तो व्हाट विल बी द फॉर्म्ड, इट इज अ प्रोस्टासाइक्लिन विल बी फॉर्म्ड. प्लेटलेट में क्या है, thromboxane synthetase, this is there, then what will happen, thromboxane A2 that is formed. So this is a aggregatory and this inhibit the aggregation. I stand for inhibitor and this stands for, यहाँ पे लिख देते हैं PGI2, ये aggregation करती, this is going to inhibit the aggregation. Now if you are going to give the aspirin, it is going to inhibit this COX irreversibly at both the side, चाहे वो प्लेटलेट है चाहे आपका वेस्कुलर एंडोथेलियम है. बट द थिंग इज, ये तो इसने पक्का इसको परमानेंटली इट हैज इनहिबिटेड दिस कॉक्स एंजाइम. अब विद इन द प्लेटलेट देयर इज नो न्यूक्लियाई, सो नो कॉक्स विल बी फॉर्म. जो था उसको तो उसने इरिवर्सिबली इनहिबिट कर दिया. नाउ देयर इज नो न्यूक्लियाई, सो देयर विल बी नो सिंथेसिस ऑफ द कॉक्स. तो पहले क्या, पहले इसने एस्पिरिन इट हैज इनहिबिटेड द कॉक्स एट बोथ द साइड, यहाँ पे भी प्लेटलेट में भी और एंडोथेलियम में भी, ये भी इनहिबिट हो गया, ये भी इनहिबिट हो गया. तो व्हाट हैपेंस, देयर इज अ बैलेंस दैट इज फॉर्म्ड. एग्रीगेशन वाले को भी इनहिबिट कर दिया एंड द प्रोस्टासाइक्लिन व्हिच इनहिबिट द एग्रीगेशन उसको भी कर दिया, तो इफेक्ट आपका ऐसे हो गया. नाउ व्हाट हैपेंस, aspirin it inhibits the COX irreversibly at both the side. Now within the platelet there is no nuclei, so no new synthesis of COX will happen. It will be only after 7 to 10 days, or you can say 7 days, because platelets life is 7 days. Only in the new platelet it can form. So new platelet they are required to form the thromboxane. On the other hand, prostacyclin which was here in the endothelium, aspirin it is going to inhibit this here also COX irreversibly, but Endothelial cell, they have the nuclei. So what happens? Because the nuclei, they are there, so synthesis of the prostacyclin can happen in the endothelium. यहाँ पे आपकी synthesis हो जाएगी prostacyclin की. So what will happen? Prostacyclin, it inhibit the aggregation. तो आपका क्या है, ये आपने inhibit कर दिया और इसको आपने नहीं किया. So we want an antiplatelet action. So antiplatelet action will be there. Now how much you are supposed to give? It is 40 to 325 milligram of the aspirin, or you can say low dose of the aspirin, that is going to exert the antiplatelet action. Now why low dose of the aspirin it is going to exert the antiplatelet action? Because the low dose, it is going to inhibit the cyclooxygenase enzyme of the platelet before it reaches into the systemic circulation, before the deacetylation. तो liver में ही portal circulation में ही it is going to cause the irreversible inhibition of this COX. Now if you are giving a low dose, then what will happen? The less amount of the drug will reach into the systemic circulation to inhibit this prostacyclin. That's why the low dose of the aspirin it exerts antiplatelet action. जब भी ये क्वेश्चन है उसको आपने पूरे तरीके से बताना है कि एस्पिरिन it is a irreversible COX inhibitor. So what will happen with that? Normal क्या है आपका pathway कि normally prostaglandins that is formed by the from the arachidonic acid, and within the platelet thromboxane A2 synthesized, and whereas in the endothelial cell it is PGI2 that is formed. Now how the load and how the low dose it is going to inhibit only thromboxane A2 but not this one. इसको नहीं करती, इसको ये inhibit कर देगी. So we will be getting the antiplatelet action. Now coming to the next group of drug, that is ADP or P2Y12 antagonist. Here we have two group of drug, that is irreversible and reversible. Now what happens? This irreversible or reversible, both they are going to bind with the P2Y2 receptor, जो आपके ADP के receptor लगे on the surface of the platelet cell. Now the difference is here irreversible में आपका आता है ticlopidine, clopidogrel and prasugrel. Now all of them, they are the prodrug or inactive as such. Now they need the activation. So activation, it requires the enzyme cytochrome P3A4 and cytochrome P2C19. It requires the activation. Especially this clopidogrel, it requires this enzyme for its activation. Now this enzyme, it shows the genetic polymorphism. This shows the genetic polymorphism. So few individual may be poor metabolizer of this clopidogrel because of this genetic polymorphism. So now we have to do the genotyping before putting the patient on clopidogrel. Whereas इसमें ticlopidine and prasugrel इसमें इतनी ज़रूरत नहीं पड़ती है. Ticlopidine we use, and this is also just like aspirin. Aspirin was the irreversible. ये भी क्या है? ये तीनों के तीनों irreversible. All the three, they are the irreversible ADP inhibitors. So they are going to inhibit overall. Ticlopidine, this is not much used. T stands for the thrombocytopenia. Because of the thrombocytopenia, rather it is a pancytopenia with the ticlopidine, it is not used much clinically. Clopidogrel, this is used in unstable angina, then ST segment elevated myocardial infarction, and non-ST segment elevated myocardial infarction, and it is also used in TIA, transient ischemic attack, there also it is used. Coming to this one, prasugrel, this also acts in the same way just like a clopidogrel. So this is about the irreversible. So major side effect with all the irreversible is bleeding. Now, if I have to plan the surgery, then what will happen? I have to stop these drug. And if per person is taking aspirin, stop the aspirin 7 days before the surgery. Now we have another group of the drug. This is reversible. इसमें आपके आते हैं Cangrelor and it is a Ticagrelor. So they are the reversible ADP receptor inhibitor. अब ये reversible है, they are going to act directly, they are more potent and they take a onset of action is fast. So rapid acting है इसमें, because they do not, इसमें क्या था, इसमें all these irreversible they need activation with these enzyme. इसमें क्या है, इसमें reversible में they do not need any activation, इनको किसी तरह की भी enzymatic activation की जरूरत नहीं है. So they are rapid acting, onset of action is fast and they are potent also. This one is we give IV and this one is we give the oral route. जहाँ पे आपकी percutaneous intervention, जहाँ पे आपको fast acting चाहिए, we can give this with the percutaneous intervention during the surgery and after the surgery. Then also we can use this group of the drug. And bleeding is जितने भी antiplatelet drug है, most of the time you will see the side effect, that is bleeding. Now coming to the next group of drug, that is GP2B3A receptor. इसमें आपके आते हैं abciximab, tirofibine and Aptifibatide. Now, if the drug it is blocking this, so what happens? This is the fibrinogen binding receptor. This is the final pathway or final step of the aggregation of the platelet. So what happens? This fibrinogen, it is going to cause the cross linking of the platelet. So thrombi or platelet plug that is formed. If I am giving this drug, ये वाली अगर मैं ड्रग देती हूँ, then what will happen? This is one of the most effective, the strongest antiplatelet drug. ये बिल्कुल final step को inhibit करती है. Like if I give this drug, this may happen. But if you are giving this drug, then platelet plug formation won't be there. इसमें आपका abciximab है. जब भी बेटा A भी आता मैब से हमेशा रखो कि their source is from the monoclonal antibody. ये भी, this is also from the monoclonal Fab. This is the Fab fragment, the monoclonal antibody. So it inhibits the GP2B3A receptor. Its duration of action is less, but it acts for a longer. ये inhibition है, ये काफी कम time के लिए होती है इसकी, this drug. But its action, it stays for the longer time because it blocks the receptor which is also present on the von Willebrand factor. Whereas these two, tirofibine and aptifibatide, they do not block the receptor which is present on the von Willebrand factor. They totally block the factor, only receptor GP2B3A. They are the antagonist of this. So what is the main side effect with this group of drug? This is also cause the bleeding. Now next is protease activated receptor antagonist, PAR. So these are the receptor for the thrombin. ये thrombin के receptor. So thrombin, this also causes the platelet aggregation and activation. So if we are going to inhibit that, we can give this thrombin receptor antagonist. This act through this receptor PAR. So we are using PAR antagonist. So important drug is Vorapaxar and Atopaxar. So by giving these different type of drug which act at a different sites with a different receptor, we can get the antiplatelet drug. Now where we use this antiplatelet drug? So therapeutic uses of antiplatelet drug, the main is it is used in myocardial infarction. So in myocardial infarction, usually either you give a single drug or you give a combination. आप चाहे लो डोज एस्प्रिन दे दो पेशेंट को, या एस्प्रिन यहाँ पे जैसे लो डोज एस्प्रिन दिए पेशेंट को, फिर एस्प्रिन एंड क्लोपिडोग्रेल, एस्प्रिन एंड डाइपाइरिडोमेल. दिस इज जस्ट टू प्रिवेंट द री इन्फेक्शन. अगर पेशेंट को एक बार हो गया उसको फिर से ना हो, so we give a prophylactically all these drugs. Then unstable angina. In the unstable angina, again we give a combination of aspirin with the clopidogrel and aspirin with the prasugrel. So this is to prevent the, यहाँ पे MI में क्या था, to prevent the reinfarction. Unstable angina में क्या है, to prevent the MI. Now coronary bypass graft implant, इसमें that is the third. So this is we use during the surgery and after the surgery to maintain the patency of the blood vessels. उसमें हम करते हैं. Now prosthetic heart valve. Prosthetic heart valve में क्या है कि thromboembolism ना बन जाए. That's why we use this antiplatelet drug. Then peripheral vascular disease, same here also with the venous thromboembolism. इसमें भी वही reason है. That's why we use. Then in the cerebrovascular transient ischemic attack, we again use a combination of aspirin and clopidogrel. That's all about the antiplatelet drug. If you like my video, so kindly like it and subscribe my channel and put up important points in the comment section. If you want any other topic on which you want to make me a video, so you can write that also in the comment section. So see you in my next video.